Just to sum up, there's a number of key state issues which I've highlighted there. Particular ones I want to flag is that for innovation, some people ask me, well, how do new things get started? This still reinforces previous history of volumes and so on. But the state funding model provides for payment of innovation and start-up models outside the ABF. Obviously, once then a new service gets up and running and functioning, then it can start to be funded through its volumes. That loadings on pricing are not the only lever for getting change in the system, and we have to look at a whole comprehensive range of initiatives around accountability to reporting, funding requirements, which can create incentives and structures and frameworks to support moving towards the right models of care. Pricing is one of those, but not the only one. We have an ABF readiness review process which has been completed, and each district now has a comprehensive assessment developed with the district itself about the things it needs to have in place and the work it needs to do to be ready to operate in this environment. We also still have a raft of issues at the national level that we're still hotly debating, and I've just listed a few of those there. The debate about what's in scope and out of scope for Commonwealth funding and for ABF is a critical one. But how we treat private patients in this mix and the funding flows in relation to that, how we treat privately referred non-inpatients is a major focus, how we develop the funding models for mental health and subacute, just to give you a flavour of some of the issues that are still very much in play. So look, there we have it. That's a lot to digest, but as I say, during the course of the day, there's a chance to start to unpack this and to ask questions and to dive deeper. It is a fundamental reform. It is not just about a different budget model that satisfies the bean counters. It is a model that starts to fundamentally relate the state health budgets to a system as to where that money's going and what it's doing. And then that leads to all sorts of appropriate questions. Is it doing the right things? It also allows for a much more rational discussion about the adequacy of funding, the sorts of conversations we'll be having between ourselves and Treasury going forward will be much more about here's the you know, sort of the pressures, volumes, demands, costs, benchmark pricing, benchmark models that we have to face. Here's the you know, what are the right funding models, levers, rates of increase and so on that the state within its budget framework has to seek to support, rather than the much more traditional historical models which are all about various interests lobbying to get their particular interest in front of government and to take priority. This model leads to a much more transparent assessment of that. But most importantly, it will provide real information locally to understand what's going on, understand where the money comes from, what it's going to, and then with our local devolved model, to be able to make much more of those decisions locally, as well as to engage in what's going to be a much more ad hoc conversation with the funder and the purchaser, the ministry, about how we fund these services, how we design them, what we need to do on a statewide basis to support you in delivering services, giving you the tools to be able to start to say, if I in talking this through with Brian McCorn recently, if you go back to that budget we had, there it is. This is a traditional budget. The health debate tends to be about the 2%, if we're lucky, extra things, which are all this list of things that were new budget initiatives that got parcelled out that year, and we don't go and debate what's going on here with the 98% of the funding and what we do with that. And that's quite critical to this model, to unpack that and work out how we best apply those funds, not just add on these enhancements that come each year in increments of 2% or so. So that's it, and I'm sorry if I've crowded the next speaker's time. We'll work something out. Thank you.